Hi, this is Jeana at Art of Skincare. Today I want to talk to you about the neck. As we hit menopause and the estrogen levels in our skin start to deplete, we really start to see a loss of collagen and a loss of skin density, and that really affects our neck. So I have some tips for you today that have really helped my neck, and I think they'll help you too. So I'm 59 and I really started noticing from 55 on that my neck was really changing. I started seeing a little bit of banding on the neck. I started seeing the texture of my neck kind of mush out, kind of the pores and texture started looking more loose and soggy, saggy. It wasn't so good. So I started playing around and looking for some things that would really make a difference for my neck. I did a lot of trial and error over the last year, especially trying to find something that was going to make a big difference. And I finally stumbled on it after having COVID earlier this year, because with COVID, I had spent so much time in bed and reading on my devices, my Kindle and whatnot, that my neck creases became very pronounced and very dark, and I had to find a way to combat that. So today I'm going to show you what my neck routine looks like, and I'm really loving it. I have 3 steps in my neck rejuvenation routine. So I'm working on firming the texture of my skin, plumping the skin so it has better skin density, and I'm also working on the dark pigmentation on my neck. I tend to get dark pigmentation all around the outsides of my neck and dark in the creases of my neck. What you're going to need for this system is the MBK curve. I use the ultrasound and I also do the RF with this. You are going to need Nelly DeVos lifting complex. You're going to need a spritz, and you're going to need a gel, like a conductive gel or any kind of skin gel. And then you're also going to need your finishing cream, which is going to be from Rhonda Allison. This is the BioReform 28. Number 1, we're going to grab 1 pump full of the lifting peptides from Nelly DeVos. Apply those to the neck, chest. You can also apply to the chest. Now I've grabbed a mist. I'm going to use Neogenesis moisturizing mist. And then I'm going to grab my curve and I'm going to use the ultrasound setting. There on the strongest setting. And when you're using the curve for ultrasound, it's this plate right here. So this is the plate that I want to have contacting my neck. I'm just going to work this serum into my neck, usually for about 3 minutes or so, just until I lose all my glide. This is a nice serum with a nice amount of glide, and if you just add a mist to it, it's really going to help with that penetration and give you a little bit more time using the ultrasound. Now, lifting peptides are fantastic. It has the peptides in it that you need for firming the skin and reducing lines and wrinkles, but it also has vitamin C and Bellus perennis in it. And what that means is that it's also brightening. So this is really going to brighten up that dark pigmentation that I get on my neck within the creases, as well as just the sides of my neck. So if I want to do a little more, I can spritz a little more. Do a few more minutes on ultrasound. And now I'm ready to do my radio frequency. So I'll turn my device off. I'm going to grab some conductive gel. I love to use the AOS gel. This gel, you can apply it to your skin and you don't have to rinse it off. It won't cause any pilling or any problems with your moisturizers or makeup, so you can use this and leave it on all day. So I've applied my gel. Now I'm going to apply some more moisturizing mist. And now I'm going to grab my curve. I'm going to turn it on. This time I'm going to choose the RF setting. And I'm going to turn it up to the full strength. And I'm going to use vibrate with it. I like using vibrate with my RF. So now I'm vibrating. Now RF are these little flat pieces on the outer edge. So that's where you want to have contact. You don't have to have them all contacting at the same time. Even just one contacting your skin is fine. So I like to do this routine about every other day. And the reason I can get away with doing it every other day is because I'm only doing it for 3 minutes. So I'm just going to massage with my RF until the gel is no longer slippery and the curve doesn't glide anymore. If I want to get an extra minute or two in, of course, I can always grab my moisturizing mist, give a couple squirts, and that will reactivate my gel and give it the slip that it needs. Now it's important with the neck, get behind the neck as well. Get all the way around because you want to be firming and lifting everywhere. Spend a little time on those little horizontal lines. There, and now when I don't have any glide, I know I'm done. Turn my device off. And now I want to use my finishing cream. That's where I pull BioReform 28. BioReform 28 can be used morning and night. Some people who have more sensitive skin, because there's 28 active ingredients in this, some people find that they can only use it once a day or every other day. I usually find that I can use it twice a day, but I've been using this for a few years now, so my skin is used to it. So now I'm just going to apply my finishing cream, BioReform 28. And my system is complete. This is something that I like to do in the morning, like I said, every other day. You could do it in the evening if the morning is too busy for you, but you don't want to do it more than every other day, and you don't want to do it twice a day. So do it once a day, every other day, just about 3 minutes on each setting, and I think you'll see a nice difference in your neck. I know that I did.